that's hot. Hot, huh? Yeah, we're talking hot. Wow, it can't get any hotter than that.
You know about heat. It makes you grumpy, you move slower, you're uncomfortable. But did you know that about 500 people die from heat-related illnesses each year? Let's make sure you're not one of them.
Let's talk about heat stress. Simply put, heat stress happens when your body has to work too hard to cool itself. Heat stress disorders include sunburn, heat cramps, heat exhaustion, and heat stroke.
Are you at risk of suffering from heat stress?
Anyone who works in hot or hot and humid conditions is at risk. This includes people who work outdoors in hot weather, such as construction workers, groundskeepers, and public safety officers. Anyone who works indoors in a hot environment, such as a foundry, in bakeries or kitchens, in boiler rooms, and in many manufacturing plants. Other people at risk are workers who wear full-body protective suits. Even professional athletes are at risk. In hot weather, the inside of a race car can get up to 140 degrees.
Now that is hot.
And the risk of heat stress increases with several factors, such as aging, pregnancy, obesity, poor physical condition, alcohol or drug use within the previous 24 hours, chronic illnesses such as hypertension, circulatory problems, or diabetes, a recent illness that caused fluid loss, such as diarrhea or vomiting, a current infection or fever. Some medications may also put you at a higher risk for heat stress. Check with your doctor about any medications you're taking.
Before we go any further, let's talk about how your body handles heat.
Your body is always generating its own internal heat from processes such as digestion, muscle activity, even breathing. Your body likes to stay at an average temperature of around 98.6 degrees. That means your body must get rid of internal heat at the same rate it creates it to maintain this stable body temperature. The process of handling heat is called thermoregulation. But factors outside of the body can make the process of thermoregulation more difficult for our bodies. How easily you release body heat depends on your surroundings, your level of physical activity, the type of work you're doing and the time spent doing it, and the recovery time between work periods. When your core body temperature rises above 98.6 degrees, your body's cooling system is activated, just like the thermostat in your home. Your heart begins to pump more blood. Blood vessels expand and the blood is sent to the upper layers of the skin, where it is cooled by the surrounding air. That is, when the outside temperature is lower than your body temperature.
But what happens when the outside temperature is higher than your body temperature?
Well, you actually begin to absorb heat from the environment. Not good when you're trying to stay cool. So your body activates another cooling method, evaporation.
We're talking sweat, baby.
The evaporation of sweat becomes the body's most important cooling method. Sweat glands release liquids containing salt and electrolytes onto the skin surface, where it is evaporated and the skin cools.
But sweating can also make things worse when you lose too much body fluid and minerals. Most people will lose about a quart of sweat an hour when working in extreme heat. This puts even more strain on your circulatory system since it lowers the amount of blood in your body. And there's another catch.
If the environment you're working in is humid, there will be too much water vapor in the air for your sweat to evaporate. So even though you may be sweating buckets, you're not getting rid of heat. When your body can no longer effectively control its core temperature, its natural defenses may just shut down. Then your core body temperature can rise to a dangerous level, possibly leading to heat stroke.
Heat stroke is the most serious of the heat stress disorders. But before we get into that, let's talk about some of the minor heat stress disorders first.
Sunburn can really be uncomfortable.
Yow, that's hot.
But worse than that, sunburn can keep your body from cooling itself properly. When your body tries to rid itself of excess heat by directing blood to the skin surface, sunburned skin is already hot and interferes with natural cooling. This can lead to a more dangerous heat disorder. So wear a protective sunscreen and try to limit sun exposure on bare skin. Heat rash, also called prickly heat, is another minor heat stress disorder. Heat rash develops in situations where your sweat cannot evaporate and stays trapped close to the skin, such as in a hot, humid work area or when wearing heavy or tight clothing. Because your skin stays wet for long periods of time, your sweat ducts become plugged and a red, itchy skin rash develops. To avoid heat rash, try to rest in a cool place for part of each workday. Also, bathe regularly and keep your skin clean and dry.
Major heat stress disorders include heat cramps, heat exhaustion, and heat stroke.
Heat cramps can occur when you sweat profusely, drink lots of water, but don't replenish the salt you have lost in sweating. Your body needs salt to keep your muscles working smoothly. If you experience cramps, which can sometimes be severe, move to a shaded area and drink lightly salted liquids. 1/4 teaspoon of salt per quart of water is a good rule of thumb. If your cramps don't go away, seek medical attention. Heat cramps signal that your body's cooling system is getting overwhelmed and that a more serious disorder could occur if you're not careful. Heat exhaustion occurs when your body's cooling system can no longer do its job. The surface blood vessels that enlarged, trying to cool your blood, collapse from the loss of body fluids and minerals. The symptoms of heat exhaustion manifest as heavy sweating, intense thirst from dehydration, cool, moist skin that can be clammy and pale, a weak and rapid pulse, low to normal blood pressure, nausea, dizziness or fainting, fatigue, weakness or loss of coordination, and headache.
What do you do when you think a coworker is suffering from heat exhaustion?
First, move the victim into the shade or a cooler area and cool them off as fast as possible. You can do this by removing clothing and shoes, fanning them, and if necessary, pouring water on them. Have the person drink plenty of fluids. If treated promptly, heat exhaustion has no known permanent effects. But if not treated immediately, heat exhaustion can turn into heat stroke with very little warning. Heat stroke can be deadly, so symptoms should not be taken lightly. Heat stroke occurs when your body has depleted itself of salt and water supplies, when sweating is no longer effective and therefore you stop perspiring, and your body temperature soars to fatal levels. Early symptoms of heat stroke are body temperature of 105 degrees and above, absence of sweating in most cases, excessively hot red or flushed dry skin, rapid pulse, difficulty breathing, headache or dizziness, confusion or delirium, weakness, and nausea or vomiting. Advanced symptoms may include seizures and convulsions, loss of consciousness, deep coma, no detectable pulse, and body temperature over 108 degrees. Someone having a heat stroke needs emergency medical treatment immediately. While waiting for assistance, you must lower the victim's body temperature as fast as possible. Move them to a cooler area or provide shade. Immerse the person in water if possible, or soak their clothes in water. Massage the victim's body with ice and fan them vigorously to increase cooling. Never give liquids to an unconscious victim.
Heat stroke affects your body at a cellular level. Brain, liver, and kidney cells are destroyed, as well as muscle tissue. If not treated quickly enough, heat stroke can result in permanent brain damage and can even be fatal.
Sometimes the symptoms of heat stroke can be masked. When a worker has been involved in a lot of physical activity, they still may be perspiring, and their cool skin may hide a dangerously high core temperature. Also, a collapse from heat stroke is often mistaken for a heart attack or head injury. Be alert to all the symptoms of heat stroke so that the treatment is not delayed. Remember, if you have suffered from heat stroke in the past, you may be more susceptible to heat disorders for the rest of your life. So take adequate precautions.
Now that you know what heat stress disorders look like, let's talk about how you can control and prevent heat stress.
One of the best ways to prevent heat stress is by gradually getting used to the heat in your work environment. This is called acclimatization. With gradual adjustment, a worker can generally become acclimated in 5 to 7 days. However, some people take longer. And if you're out of the heat for a period of time, remember that you'll start losing your acclimatization after 1 week, and you'll lose it completely after 1 month. Another way to control the effects of heat is by following smart work procedures. Alternating heavy work with less strenuous work keeps you from overexerting. Taking breaks in cool rest areas will help keep your core temperature down. Rotating physically demanding tasks among different workers also helps, as long as each worker has been acclimated to the work environment. And save the most demanding work for cooler times of the day, like early morning or in the evening. Fluid intake is a crucial way to control heat stress. You need to replenish the water and salt your body loses through sweating in order for your natural cooling system to function. Fluid intake should equal fluid loss. This means drinking 5 to 7 ounces of water every 15 to 20 minutes, even when you're not thirsty. Because when you're thirsty, it's too late. You'll have lots of catching up to do to hydrate yourself. Drinking high-quality isotonic replacement fluids, commonly called sports drinks, is a good way to replenish fluids and electrolytes lost. These fluids are usually high in glucose or fructose and are easily digested by your body. Stay away from overly sugared drinks and never drink alcoholic beverages while working, since alcohol dehydrates the body and dulls the senses. Even drinking alcohol within 24 hours before work can seriously affect your heat tolerance. Caffeine also contributes to dehydration, so avoid coffee and tea as well. Your eating habits are an important part of controlling heat stress. The normal American diet usually has enough salt in it to support the body's cooling efforts. But if you sweat continuously or repeatedly, you may use extra salt at the table.
But consult your physician if you have heart problems or have been placed on a low-sodium diet. And by the way, salt tablets are not recommended since they cause dehydration and are not absorbed quickly into the system. As a matter of fact, use of salt tablets can cause further heat stress.
Most people don't realize that eating hot food adds directly to body heat. And heavy or large meals reduce your ability to get rid of heat, since they redirect blood flow to your digestive tract instead of your skin surface. So make sure your lunch meal is cool and light, and save the heaviest meal of your day for after work. What you wear when working also affects your ability to handle the heat. Ideally, you'll want to wear lightweight, light-colored clothes. Avoid polyester since it absorbs the heat. Loose-fitting clothes provide area for sweat evaporation. And cover your head to protect it from the heat. Your hard hat blocks heat and damaging sun rays. Some workers don't have a choice about what clothing to wear at work. People in specialized jobs that require protective bodysuits must take special precautions against the heat. Limiting work time in the suits is critical. Also, be diligent about replenishing water and salt, lost through sweat. Your employer will monitor the overall temperature of the work environment and your core body temperature to make sure you stay within a safe range. Working in the heat is not easy, and sometimes it can be the cause of accidents. Your glasses fog, sweat gets in your eyes, your hands get slippery, and sometimes even your judgment is off.
You can make your job safer by understanding the effects of heat stress, by knowing the symptoms and treatments for heat stress disorders, and by taking precautions. So on those days when it can't get any hotter, you won't lose your cool.
Now that's cool.